Posterior cerebral artery stroke. The posterior cerebral artery originates as a terminal branch from the basilar artery, and it is connected to the internal carotid artery through the posterior communicating artery to complete circle of Willis. This artery supplies the midbrain, thalamus, medial temporal, and occipital lobe. The posterior cerebral artery divided into two main segments. The P1 segment, which lies proximal to its junction with the posterior communicating artery, and the P2 segment, which lies distal to it. P1 segment supply midbrain and thalamus, while P2 segment supply medial temporal and occipital lobe. Occlusion of the P1 segment will affect the midbrain, and especially two important structures, which is the ipsilateral oculomotor nerve and the crus cerebri, which contains the descending corticospinal fibers. This will result into a syndrome called Weber syndrome, which is ipsilateral oculomotor nerve palsy and contralateral body weakness. Sometimes the infarctions occurs at a higher level, affecting the radionucleus together with the ipsilateral oculomotor nerve, resulting into ipsilateral oculomotor nerve palsy with contralateral ataxia and tremor, a condition called cloud syndrome. Combination of these two lesions is called Benedict syndrome. Occlusion of the P1 segment also will affect the thalamus, resulting into impaired sensory perception over the contralateral half of the body, a condition called Guerin-Rossi syndrome. Occlusion of the second segment, which supply the inferior and medial temporal lobe, result into memory impairment, which is usually transient. However, involvement of splenum of corpus callosum resulting into alexia without agraphia, which is inability to read without impairment of writing. Occlusion of the P2 segment will also affect the occipital lobe, causing homonymous hymenopia, in which the patient cannot see the ipsilateral nasal and contralateral temporal visual field. So the question is, what happens when both posterior cerebral arteries are occluded? This will result into cortical blindness, and when the patient is unaware of his visual loss, this is called Anton syndrome.